guys, this is Winnie with All Things PSW. Welcome back to our next video. Thank you so much for reaching out. I am doing another type of video today, but before I begin, thank you to everyone who has commented, liked, shared, subscribed. I know a lot of you have been calling me, which is wonderful. I've done quite a few Zoom sessions with tutoring, and also some people are purchasing the mock exams. So far we're really making headway, guys, and I am hoping that it helps you in many different types of ways. But this video is just gonna be a little bit quicker than other videos. I think you've seen a video like this before where it's just something to say, these are 10 tips or these are 10 random questions that you cannot get wrong. It's so different if you kind of get into an exam and you have a very difficult exam. You might feel better if you don't succeed. But if you have an exam and say, man, I should have gotten that, it kind of makes you feel bad. So the purpose of this video is to ensure that you do not have that feeling when you write your NACC exam. So again, our video today is titled 10 random questions you cannot get wrong in the NACC exam. So let's get started right into it, guys. So the very first thing that I always tell you or tell everyone, tell my students, is prefixes and suffixes. So understanding a prefix and a suffix will help you with those complicated words. Sometimes you see a question and you don't know what they're talking about. You're like, what does this word even mean? What is bradypnea? Like, what's tachypnea? Like, I've never heard of this thing before. So we're going to deduce what that means. So in most of medical lingo or medical terminology, we have what they call the prefix, and pre means before, and then the suffix comes after. So a prefix is just honestly a summary. It's just a word element at the beginning of the word. And then a suffix is a word element at the end of that particular part of the word to change the meaning of the word. So let me explain that a bit further because maybe I've lost you a little bit. So the first thing is A. A means absent, so A is without. An example is apnea. If I say apnea, that means absence of breathing, right? So if you see the word A, you know it means absent. Hypo. Hypo means low. Hypothyroidism, meaning low thyroid. Hyperthyroidism means high thyroid. Bi means two. Bilingual. If I'm bilingual, I can speak two languages. I actually am bilingual. I speak English and Shona, but some people speak multiple languages, so they do a lot more. But if you speak English and French, for example, you can be very employable in Canada. So bi means two. Brady means slow. If someone says bradypnea, it means slow breathing. Bradycardia means slow heart rate. So once you know what these words mean, you can kind of decipher something. Like if you see Brady in a particular question, you'll know that it's something to do with something slower than usual. And you can kind of look at the symptoms or the answers and say, what here looks like it could be related to something going slower than normal. And the last thing is tachy. Tachy means fast. So the suffix, like we said, is at the end of the word element to change the meaning of the word. So we spoke about pnea, which means breathing, respiration. A good example is orthopnea. Ortho means to lay down. So if you have orthopnea, it means as you lay down, your breathing changes. Thermia means temperature. Hypothermia means I have low temp. Hyperthermia means I have a fever. Cardia means my heart rate. Itis, as we always say, means inflammation, appendicitis, bronchitis, conjunctivitis. So anything with itis at the ends means inflammation, which means infection, which means you're looking into high fever, you're looking into high white blood cells, you're looking into something that indicates that an infection is going on. Tension, blood pressure. And it just shows that they're talking about the tension within the arteries, which are the ones that go away from the heart. So if there's tension, it means there's pressure. So if it's hypotension, you have low blood pressure. If it's hypertension, you have high blood pressure. And last but not least, sepsis is infection. So if I have asepsis, it means I am avoiding infection. So I have a clean area. There are different types of sepsis. There's medical asepsis, which is what we do from day to day. And then there's surgical asepsis, where we also remove spores. Now, always say S means spores, and then you want to make sure that you follow any type of surgical technique, or, when you're doing it, you have a sterile field and all that stuff. But again, I do not want to digress. The main point of number 1 is that you can kind of decipher a question based on the prefixes and the suffixes. Number 2. So you should know your vital signs. This is something that you just need to know. It's not something that I can say, cram this. That I have little antidotes for. You could come up with a mnemonic if you want, but at the end of the day, you just need to know your vital signs. What are vital signs? So your blood pressure is a vital sign, your temperature is a vital sign, your respiration is a vital sign, and your pulse is a vital sign. So I'm hoping you kind of know what these terms mean, but your temperature just means how hot you are. Are you hot? Are you cold? With COVID, a lot of us had high temperature, which is also known as a fever, which is also known as being febrile, which means that, hey, I have a high temperature. If you don't have a high temperature, it's afebrile, which goes back to the prefix and suffix, where a means no and febrile means temperature. So temperature just means how hot I am. The second one is blood pressure. So we just spoke about blood pressure being the tension in the arteries. We want to maintain a certain type of blood pressure, because if it's too low, you're predisposed to dizziness and even, I would say, shock. If it's too high, you're predisposed to having a heart attack, you're predisposed to having a stroke. So you want to ensure that your blood pressure is normal. What's respiration? It's just your breathing rate. This is easily seen when someone is laying in a bed on their back in a supine position, and then you can see how the chest is rising and falling. We call that respiration. Last but not least, your pulse is your heart rate. So these values are important to know. So I've listed them for you over here. Please just ensure you review them. But just to recap, blood pressure 120/80 is normal. Anything from 140/90 is hypertension, and anything 100/60 is hypotension. Your normal temperature is 37.5 and under. Anything over means you have a fever or febrile, which is febrile, and anything under is fine. And your heart rate or your pulse should be 60 to 100. If you are in a position where you are highly agitated or you run every morning, your heart rate will definitely be higher. But if you stay in that persistent state of having a very high heart rate, it's not good on your heart, because it means your heart is working extra to get a certain way. And last but not least, the breathing rate is called the respiration, and the normal values are 12 to 20. So the next question, so this is very interesting. So when I do have students who I tutor, I always ask them, especially if they've written before, like what was really kind of confusing, or what was shocking in the exam. And I was surprised to hear that they ask a lot of these symbols, which are women's symbols, right? And they also ask a lot of fill in the blanks, where they'll put a symbol and say, what is the symbol? So I decided to put it in as a reference for you, because maybe this is something you didn't even think to review because you think it's unimportant. So these are the material information system symbols that we have. Well, workplace hazardous material information system symbols. So if we look at it, these are the pretty much the ones that you really should know. So we're going to go across. So the first one is toxic. B, dangerous for the environment. C, corrosive, or anything that makes it corrode. D, compressed gas. E, explosive. F, flammable. G, harmful or irritant. H, health hazard. And I is oxidizing. So again, I just don't have any particular tricks to tell you. It's just something you need to know. But the only thing that I will actually call out just for you to recognize, and a lot of people don't, is that there is a difference between F and I. So if we look closer at F, you can see the flammable, but it's kind of like a fire inside. And then if you look at the very bottom to the very last one, which is I, it's oxidizing. That O is what shows you that it's oxidizing. So the O stands for oxygen. So just make sure you understand the symbol for flammable and that you also understand the symbol for oxidizing. So please know your symbols, guys. In your book, like if you look in your textbook, there are other symbols like this is for hand washing, this is do not wash, this is do not do this. Those symbols are important. Imagine you lose a mark over symbols. I think you'd be so upset. So just make sure you understand these symbols. The fourth thing you should remember are the types of abuse. So I always say to everyone that abuse is the easiest module to get all the questions right. I will not go too far into it. I'm going to summarize it, but my hope is I will do some abuse questions and I'll get a little bit deeper into it, just depending on if you guys are interested, but it's something you can definitely get 100% in. Okay, so we have many different types of abuse. The first type is emotional. So emotional abuse are these things like the words, you are fat, you are ugly, you are worthless. Those words can cause mental harm and affect somebody's self-esteem. Physical abuse is a bit different. This is where there's actually something physical, where you can see an injury. Maybe I hit you, or maybe I was hit. Maybe I threw you down the stairs. Maybe I threw a pot at you. This is a force to anybody's body that results in injury and unfortunately sometimes death. Sexual abuse is just any type of sexual act where there's no consent. Can a husband cause sexual abuse to their wife? Yes. Can a wife cause sexual abuse to their husband? Yes. Because every time you need to have sex, it has to be consensual. Can a boyfriend do the same and girlfriend and vice versa? Yes. All types of sexual abuse must be both parties agreeing to the act. Financial abuse is misusing someone's property or money, and I think we've discussed this numerous times in other videos as well. So if you haven't reviewed our other videos, please do, just for more context. So assault and battery. So I actually did get a call today, just someone asking me like, what's the difference between assault and battery? And I said they actually seem very similar, but assault is more of a threat of, I am going to do this. If you do not listen to me, I am going to beat you. You do not physically touch the person, you do not do anything, but just the threat itself is invoking fear, and that is what we call assault. Battery, however, is when I take that threat and make it a thing. Now I've actually beat you. Now I've actually caused physical harm. So, unlike assault, I don't even have to warn you. I can just come and beat you, you know? And it's not a good thing, but battery can just be something that you do and you cause physical harm. Maybe I'm pushing someone from the behind. Maybe I'm even coming in front of somebody and I just push them from the front. As long as I've touched you and made you feel uncomfortable or caused any harm, that is called battery. So that's the difference between the two. False imprisonment. So if you think of the word imprisonment, it means you're being in a prison and you're kind of maybe locked up in a particular area, and maybe you're just a little bit uncomfortable in that area. So false imprisonment is where you have anyone who feels confined in a particular bounded area. They feel that they cannot move. They're stuck in a particular place. Neglect is different. Okay, before I move on to neglect, I will discuss false imprisonment. So if you have somebody in the toilet, you haven't checked on them in a while, they were supposed to be checked, you're supposed to put them in the toilet at 2, you didn't check on them, you falsely imprisoned them. Or you put someone in a room because they're screaming and you put them in the seclusion room, and now you've put them in that area, you falsely imprison them. But it also falls very close to neglect, because now you're failing to observe due care. But a very good example of neglect is when you don't check someone's restraints every 15 minutes like you should, or you don't change someone's depend every 2 hours like you should. You don't reposition somebody every 2 hours like you should. Those are examples of neglect. So that's the difference. So neglect is failing to observe what you have studied. Everything we're talking about right now. It's just you failing to actually observe that. And last but not least, medical negligence refers to a medical professional's act of carelessness causing harm to a patient. Next point, number 5, is the difference between a CVA and an MI. So again, they might ask you CVA and MI. Why they are going to ask you this is because they're expecting that if you're in report, getting any report or getting an update off a patient, that you're not rushing to say, what does CVA mean? So that's why they want you to know what these mnemonics or acronyms mean, so that you are not scounging and trying to figure out what does this mean. So what's a CVA? This is a cerebrovascular accident. What is an MI? This is a heart attack. But what people don't understand is that they kind of come from the same place. I'll explain that further. Maybe you get a CVA or an MI because you had a clot. Or maybe you get it because you have hypertension, which we spoke about before, with high tension in the arteries. So at the end of the day, they still caused by the same thing, but they work on different parts of the body. The CVA, which is a stroke, affects my brain. Well, not my brain, but someone's brain. And a heart attack, which is the MI, affects the heart. So let's talk a little bit more about the difference between these two. So we spoke about the CVA and we said it's in the brain, but as a result of this, your brain cells cannot get the oxygen and nutrients that they need from the blood, and they start to die within a few minutes. So this can cause lasting brain damage, long-term disability, and sometimes death. So signs of stroke include the inability to move parts. So, you'll just walk in and you'll notice that, oh my gosh, Mr. Jones is kind of drooping right now. One side of his face is not moving as well as it was, or he's slurring, and one side is weaker. You ask him to raise his hands and one side is not going high like the other, and one side of the face is drooped, or the leg cannot be lifted at the same amount as the other leg. This is already what tells you that this is probably a stroke. Confusion is another sign, headache, difficulty swallowing, and like we said, difficulty speaking. But the interesting thing about a stroke is if they cannot move the right side of the body, we call that a left-sided stroke. So the stroke affects the other side of the body because the brain works in such a concrete and complex way where if one side of the brain is injured, it affects the other side of the body. Do they love to ask this question? Absolutely. So just understand that a left-sided stroke affects the right side, and then a right-sided stroke affects the left side. So MI, like we said, is a heart attack. This is when blood to the heart muscle is blocked. So this is where you can hear them say, I feel like there's an elephant sitting on my chest. I feel a lot of pressure in my chest area. I feel a lot of pain in my chest area. I feel discomfort in my arm, in my back, in my neck. I feel short of breath. Dizziness is also another sign here that you have in both. But at the end of the day, that pain in the chest area is the biggest indicator that there's something happening. Again, like I say all the time, aspirin is the number one thing to give as you wait on the paramedics to arrive. The sixth thing that you should know. These are all random questions that you should know to pass your NACC. The sixth thing is the chain of infection. So I know you've maybe seen it and it's a bit confusing and the words seem very similar. So I'm hoping I can summarize it just for you to understand it. But again, it would not make any sense for you to lose marks on the chain of infection. The reason why they love to ask about the chain of infection is because we have been in a pandemic for quite some time. They want to understand that you know that hand washing, firstly, is the best way to eliminate all types of infection. That's the most effective way. But you can also use a hand sanitizer unless your hands are visibly soiled. So understanding the chain of infection will prevent you from spreading germs from patient to patient. Remember when COVID started and a lot of homes went through so many difficulties by losing multiple patients at the same time? It was very, very distressful. It was very sad. And it was something that really showed them that infection control is a very important topic that we should discuss. So let's look at the chain of infection a little bit further. So there's 6 stages. So before infection occurs, you have to have something that's infectious. It doesn't just happen, right? So you need an agent that causes infection. So this is a pathogen or microorganism that causes disease. Once it's there, it has to live somewhere. So it might live in a person, it might live in an animal, it might live in an object, but it needs to live somewhere. So the portal of exit is how the pathogen leaves the reservoir. So usually a reservoir, to me, I always imagine something nice and warm and dark and just great for any infectious agent to just love life, right? So I'm just imagining this bacteria just sitting somewhere so nice and warm and comfortable and saying, oh my gosh, this is the best thing ever. But eventually, if it can be spread, it will leave. So once it leaves, we call that the portal of exit. This could be through me coughing, through me vomiting, and diarrhea is a very common one. So feces, right? And now the mode of transmission. Is it sexually transmitted? Or is it transmitted indirectly? What does indirectly mean? Maybe on my table, maybe on my computer, maybe my cell phone that I use, and now I got all my children using my phone. That's a method of indirect contact, meaning I didn't do it or give it to my child directly, but my child touching my phone was an indirect way for them to get this infectious agent. So again, the agent's there, it's resting in my body, it's in a reservoir, it loves it, it's warm, it's nice, it's sweet, but now it's going to leave. That's the portal of exit. What's the mode? How does it spread? Once it goes there, then it's going to enter another body, or it's going to enter another source or another animal, whatever the case may be. It can be through a wound, it can be through a mucous membrane, or something like a catheter in the hospital. Eventually, after this has happened, the hosts themselves have to be susceptible. What that means is that the host has to be able to have maybe like a lower immune system or something's going on where they can actually be affected by the infectious agent. So I always tell my classes about studies that were done back from Zimbabwe, but there was a point where HIV was so rampant, right? And they were just trying to find out like why some prostitutes were not getting HIV positive. Like they could sleep with so many different people, but they were not actually getting the transmission of HIV. And this is what always reminds me of the chain of infection, that no matter what happens, the portal of exit happens from the man that you were sleeping with, for example, and the mode of transmission was sex, and the portal of entry was, of course, the vagina through sexual intercourse. But the hosts themselves were not susceptible, meaning no matter what, they were HIV negative. I do not know whatever happened like with those studies, to be honest, but I just remember that, okay, this was an interesting fact. COVID is another example. There were lots of people who said, okay, 8 of us in our family had COVID and 2 people didn't catch it, but they did everything. They sat next to us, we would cough on them. You know, it's because that particular person was not a susceptible host. So at the end of the day, you need to understand this chain to understand how infection is spread, and also understand that you are working with vulnerable populations. So it's easy for this chain of infection to actually happen because of that particular point. The 7th thing that you cannot get wrong in the NACC is delegation. So a lot of people misunderstand delegation. They also misunderstand assigning. So what is delegation? So in order for you to really know what tasks to do, you typically follow a care plan, guys. And a care plan is something that has been set up by an individualized team, different disciplines, OT, PT, nurse practitioner, speech and language pathologist, physician, psychiatrist, mental health geriatrician team if need be, mental health outreach team, anyway, anyone under the sun, right? But when it comes to delegation, this is where you should understand that you are receiving tasks from nurses. Who are nurses? Nurses are registered nurses who have a 4-year degree, or RPNs who have a 2-year degree, and in other provinces they call them LPNs. But delegation is a transfer of function when a nurse authorizes another healthcare provider to perform tasks. As a nurse, when I'm actually delegating, I need to be sure that you, Rhonda, as a PSW, are able to perform these tasks, that it's safe, that you're not going to cause any harm to the patients who you are assigned to. An assignment is, Rhonda, you are working with room 1014 to 1022. Stephen, you are working with room 1024 to 1030. Jade, you are working with room 1032 to 1050. That's an example of an assignment. Those are the patients that are under your care. But delegation means even if you're working, Jade can come and say, Winnie, I've never done this task before. Then I can say, okay, let me train you. And then I can do a demonstration and a return feedback where I look at Jade doing the skill and I'll check it off and say, Jade, I feel you're now competent to perform the skill. I am freely able to delegate this task knowing that you can perform the skill. So what's the part of the delegation process? So the nurse must feel confident that the PSW understands the responsibilities, but they also know when to ask for assistance. Jade coming to me and saying, Winnie, I don't know about this part. That's Jade being knowledgeable about when to come. And at the end, Jade should then come to me and say, I performed the task, Mr. X handled it very well, and then we will both document that the task was provided and the patient tolerated it with no difficulties. So that is delegation. Number 8. So a lot of times, like I said, they really love to ask the cognition. I've had multiple questions, which are the two hardest, cognitive and mental health. I have a video on it as well. And I will actually do another video, which might be a little bit harder than the first one, where I get into a little bit more detail, particularly about the mental health disorders. So please look out for that. But body systems is another one as well that they have really difficult questions for. But if you are looking at delirium, disorientation, depression, and dementia, this is under Module 11, which is the cognition and mental health module. So just understand what these mean. I know I've covered them in other videos, but just in case this is your first video, welcome. But I will just summarize what these terms mean. So disorientation that occurs all of a sudden from nowhere, where right now I'm fine and then something just happens, this is called delirium. This is severe disorientation and rapid changes in brain function. So this could honestly be just something. Maybe I heard something very bad that really traumatized me. But for some people, it's usually maybe they heard the death of a loved one, or all of a sudden they're being moved from their home to a facility. These changes affect them so negatively, they get into a delirious state. It's usually temporary, but if you do not catch it quick enough, guys, it could be permanent. But once you treat the actual cause or the illness itself, it could be fine. A very, very good example is a urinary tract infection, which is a UTI. This is an example of someone, like, it could be a cause of delirium, right? So it could also be a reaction to medication, or maybe you're not eating well enough, or anything. But emotional trauma, believe it or not, is a good example. Like, I feel too, it should not be just exempt to older adults. Delirium after emotional trauma is very real, where sometimes somebody you love passes away and you literally don't remember what's happening. You don't even remember what country you're in. You're just trying to navigate. You're almost out of control. So this is something that should be treated immediately. It's an emergency state. Disorientation is confusion. So this is just, okay, I don't know who you are. I don't know my name. I don't know where I am. Am I in Milton? Am I in Hamilton? Am I in Montreal? Am I in Ottawa? I don't know. No, you know what? No, I think I'm in Africa, you know? So it's just not knowing where you are, not knowing the time. And I'm like, what year is it? Oh, it's 1942. You know, the World War is blah, 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 blah. That type of thing, right? So it's just not knowing where you are. So you're not oriented to person, time, or place. Again, this is covered in the cognitive video. I have questions on that for your reference. And the last thing is dementia. So dementia is a general term that describes the progressive loss of brain functions, including cognitive and social functions. So the last video covers dementia too, but what I want you to know is that this is something that is progressive, meaning it doesn't get better. And the medication doesn't improve it, it just manages it. But it's not something that gets better, unfortunately. Okay, the 9th point. So this is another thing that you really should not get wrong. So just make sure, guys, when you're studying, you have pictures everywhere in your room. I'm sure your spouses or your partners or your children might find it weird, but it's very good to learn from pictures. But another thing you should not get wrong in the NACC are directional terms and positions. So I'll just kind of go over them, but this is, again, nothing that I can teach you. It's just something you need to know. So an example is anterior. Anterior means at the front, or we also call it ventral. Then you have distal. Distal just means it's a part that's far from the center. Lateral means toward the midline of the body. Medial is the closest thing to the midline of the body. Posterior means the back, which is the opposite to anterior. And proximal is opposite to distal because proximal means nearest to the point of origin. So the two differences or opposites here is anterior is opposite to posterior and distal is opposite to proximal. Please look at the diagrams for more reference because I might not be doing any justice on this, but I do know for sure that you do need to know the difference in these terms. The other ones that you need to know are the actual positional ones. So what does that mean? This is like how you can lay in a bed. For example, the nurse will say, can you put Mr. Jones in a supine position? So you need to know what supine is versus say, what does that mean? That's why you are told to learn these. So supine for me is just short for spine. That's how I learned it, meaning I'm laying on my back. Prone is where that's the opposite of spine. I'm laying on my stomach. Lithotomy is usually the ones as women we know when we're giving birth or we're going for our pap smears and stuff, where our feet are kind of put on the stirrups in the vaginal exams. Fowler's has 3 parts, or sorry, it's 4. Well, no, 3. Because Fowler's is divided into 3 parts. So there's low Fowler's, which is 15 to 30 degrees. Then semi means kind of the middle of the two, which is 30 to 45 degrees. And then high Fowler's is 45 to 90. The reason why I put this in this video is because I know a lot of people have been very upset that they did not even review this. It's so important for you to understand. I will even tell you as a nurse, I will tell the PSWs I was delegating to multiple times, I need to do this. And I'm in a hurry. It's an emergency situation. So I tell the PSW, please go put Mr. Smith in high Fowler's stat, right? Because maybe he's short of breath. I don't have time for you to go look up high Fowler's. I need you to know what that means. And by the time I get there, he needs to be in high Fowler's, right? So that's why you need to know this. Sims is left side lying, typically a position used for enemas. Tredenlenburg is where it's kind of like an interesting one, but it helps with like chest drainage, you know, and sometimes dizziness. But where you put the head of the bed like lower than the actual legs. It's so interesting to look at, you know. And I actually like the word Tredenlenburg. I don't know why, but yeah. But Tredenlenburg is where you do that. And then reverse Tredenlenburg is where you make it the opposite of Tredenlenburg. Again, the only justice I can do for this is for you to look at images, but please make sure you know it, and you will thank me later. Last but not least, the last thing that I say for every question when you are really stuck, always ensure that you never pick an answer with an absolute. What is an absolute? An absolute is something such as always, all, none, every, must, never. In life, there's no such thing as an absolute. If there were, I think we would all be happy. But when it comes to healthcare, you cannot say all patients must do this. You should never do that, you know? So if you have a question like that, and it's something to do with healthcare, something to do with health, you know, you cannot say all Asians are going to be a certain way. You cannot say that. Or all cultures are going to be a certain way. So never ever pick absolutes, and that will definitely help you with the method of elimination. Okay, guys, so those were the 10 points that I wanted to share with you. I'm hoping that you did find this video helpful. Please send me some suggestions of modules that you were having a bit of a difficult time with. I know a lot of people did give me feedback about body systems, so I think I'll do more on cognitive and body systems, and I guess safety and mobility as well. But for now, whatever you decide, whatever you suggest, for sure, I will follow up with that. But I'm hoping that this video was helpful, and I'll definitely see you in the next video. Thanks so much.